So in bladder cancer, radioligand therapies are a relatively new development. There are interesting trials, I would say, and interesting targets, but most of this is, relatively preliminary data, but I think something that shows a lot of promise. In my talk, I focused on just a couple of targets, one being FAP or fibroblast activation proteins, and the other one being Nectin-4. So starting with FAP first, there is some interesting data in urothelial cancer on FAP-targeted theranostics, both imaging and therapeutic applications. In terms of imaging, we actually had a trial at UCSF, the University of California, San Francisco, that was led by my colleague Tom Hope, and that I participated in as well. Um, Looking at imaging with gallium FAP-2286 compound of patients with advanced solid tumors. So actually, this study included a broad cohort or broad population, I should say, of patients with multiple solid tumors and included cohorts with both metastatic disease as just a proof of concept, essentially cohort where we were demonstrating the feasibility of basically FAP imaging for metastatic disease, and then a cohort of patients with non-metastatic disease. As I mentioned, there are numerous tumors included in this, but in my presentation, I focused specifically on the bladder cancer subset, which included 21 patients. Actually, the highest absolute FAP uptake was observed in bladder cancer. And in bladder cancer, we really demonstrated the feasibility of the FAP PET imaging scans to detect a variety of metastatic lesions across different metastatic sites. There was specifically good detection of small nodules and small lymph nodes, those under a centimeter, and even 5 millimeter nodules were detected with FAP PET imaging. And so this suggests potential for more accurate staging in the preoperative setting and highlights potential impact of using these scans for clinical decision making because they're really able to detect very small nodules and very small lymph nodes that will appear pretty unremarkable on conventional imaging, but do show potential spread of cancer, even distant spread of cancer early on, and can again influence treatment decisions. Because of this pretty, I think, important and interesting initial imaging data that we have with FAP imaging in urothelial cancer. This leads to potentially larger trials, and we're planning such a trial right now, helping to basically stage patients with muscle-invasive bladder cancer, and also highlights the potential for FAP-targeted therapeutics. And so at UCSF, as well as a few other sites, we had the Lumiere study and still have the Lumiere study, which is a phase 1/2 trial investigating the safety, dosimetry, and preliminary activity of FAP-2286 labeled with lutetium. So this is the sort of therapeutic application of this compound. The phase 1 portion of the study completed, and recommended phase 2 dose of the study was achieved. The treatment with lutetium FAP-2286 was overall fairly tolerable. Only 7% of patients actually had grade 3 or greater treatment-related adverse events. Efficacy in a phase 1 study was modest, but the phase 2 trial is rolling out in several tumor cohorts, however, is not including urothelial cohort. So while I think FAP-targeted therapeutics have a future in urothelial cancer, it may be a different compound that we explore and not lutetium FAP-2286.